Thalidomide is an anti-neoplastic or cancer medication used by oncologists to treat plasma cell myeloma as well as other inflammatory skin diseases. In modern times, leprosy is commonly treated with thalidomide. This is a revitalization of the medication as it globally fell out of utilization after the teratogenicity was discovered by physicians. The original usage of thalidomide was twofold: as a sedative and an antiemetic to treat morning sickness in pregnant patients, the latter usage being where its teratogenicity was discovered. In 1962, doctors McBride and Lenz looked extensively into the effects of thalidomide on fetuses, and the results led to a discontinuation of the drug in pregnant patients. One case which brought attention to these effects was of a 35-year-old pregnant woman who took thalidomide before conception and in the first 3 weeks of her pregnancy. She delivered a baby with multiple birth defects who died 24 hours after birth. This case has contributed to the long-standing question in the medical community: which types of medications are safe to be used during pregnancy?
Adding on to what Seraphites said, because the drug was administered prior to the patient's pregnancy, it gave way to this new finding that the time at which an agent is administered does not necessarily coincide with the time at which it exerts its deleterious effects. The author also went on to say that certain drugs might only have a teratogenic effect because it was administered prior to the pregnancy and it had the time to develop into that mutagenic effect. So the major teratogenic effects that they found in this case report include visual defects, absence of the arms and an underdeveloped leg, congenital heart defects, as well as defects in the gastrointestinal tract that related to digestive issues. All of these findings gave way to this idea that timing has such a big role in maternal outcomes and fetal outcomes, and the medication, even if it was administered prior to the pregnancy, could still have an effect on the fetus and the baby.
The less obvious effects of thalidomide is the timing and delayed effects. Thalidomide's harmful impacts may appear weeks after exposure since the drug can accumulate in the system. Facial changes, they could show minor features such as small fading birthmarks on the face, saddle nose, small ears and slight facial nerve weakness, and gap or defect in the iris. Partial limb defects. Limbs were often shortened or slightly asymmetrical with either missing thumbs, with fewer fingers or toes, and one limb is more developed than the other. And there could be internal abnormalities such as subtle defects such as heart defects or intestinal narrowing that wasn't visible externally but could cause medical complications to the person. And the most affected infants showed normal mental development, so the drug's damage was largely physical instead of neurological.
So, after the discovery of thalidomide's severe birth defects in the 1960s, researchers began investigating other drugs. Recently, attention has turned to Tylenol or acetaminophen and its possible link to autism and ADHD. Recently, a 2024 Swedish cohort study found the slight association between prenatal Tylenol use and these conditions, but when we compared siblings, one exposed and one not, the link disappeared. So, this suggests that shared genetics or environment, rather than Tylenol itself, explains the pattern. Unlike thalidomide's clear physical malformations, potential Tylenol effects would be functional and developmental, meaning they emerge years later and are much harder to prove. So for now, experts agree Tylenol remains safe in moderation while research continues to explore these more subtle influences on fetal development. Here are references, and thank you so much.